very good morning to members of the media, members of the listening and viewing public. We are here once again, albeit this morning at a slightly different time. Sorry for any inconveniences caused. We are this morning joining you again to report from the Ministry of Health as to our circumstances there. And I have with me this morning the usual standard bearers, the Minister of Health, and the CMO, Dr. Roshan Parasham, who will cover the matters of health. But let me just begin by commenting on where we are so far and how we've been going. Citizens, basically, if I have a problem as a public officer and the Prime Minister of Trinidad and Tobago, it has to be that I have this confidence that the vast majority of our people are right-thinking and reasonable people and would understand once they are informed and told the truth in the most transparent way. I would like to believe that that is how we have gone about this matter since January, when we brought it to the attention of the national community. We got to the point where using encouragement, request, suggestion, and enforcement to ask the population to understand that our weapon in this battle is personal conduct, personal responsibility. That's where we are at the moment. And in so doing, we've asked a significant proportion of the population to stay home and only come out if it's absolutely essential. And we gave you all the examples, and we identify, as far as we were able to, identify the essential areas and ask you to use essential service in there to keep us going and to keep us alive in the face of this threat. I have been monitoring this, and the state, through its agencies and its officers, have been reporting on a continuous basis. The general impression is that in Trinidad and Tobago, the majority of people are cooperating, and that's a good thing. But it would not be Trinidad and Tobago if we don't have a minority who feel that they must go off in a different direction. I simply want to say this morning to those people, it is not a question about numbers with this problem, with this virus, and its effect on the population. One person could be the difference between success and failure. And therefore, if you believe that, as you should, don't be that person whose lack of consideration, irresponsibility, or just total ignorance would cause other persons to be endangered. Because that one person, whoever he or she might be, accidental or otherwise, has it on their radar, within their power, maybe in their history, to damage a large number of people in this country. That's the nature of the problem. So this call for personal responsibility is not just because the government wants to push you around. It's because that is the only way that we can get out of this situation. We have taken a line which might not be identical to other countries. But in this matter, governments in different countries have had to look at their own situation and make decisions in the context of treating with the same problem. The only thing we have in common is the same microbe, it's the same COVID. For example, let's take a territory that has a huge chunk of its economy as tourism. Tourism through air transport, tourism through cruise ships. Those two industries have virtually been forced out of business because of the nature of their business and the nature of the problem. As I speak to you now, there's the pain of watching two cruise ships with people from all different nationalities drifting on the ocean, not being able to find a port of call. That is a story of our time. I'm sure many people, most people, never expected that that would be a story of our time, that there are thousands of people on cruise ships cannot find a port of call because if you're carrying the virus, nobody wants you. And our history as human beings has examples of this from an earlier time, where people's humanity were questioned and people were treated in that way. And it's just reading it as part of history is painful to read, to think that people were subjected to that. But sometimes those pain are what the circumstances demand if more pain is not to be borne. So I hope that at the end of the day, by the end of this evening, we would hear better news about those people. But the decisions are made by countries and authorities in defense of the vast majority of people. So there are other countries that, so if you've pretty much shut down your airport and you shut down your seaport and your business was tourism, it's easy then to have a 24-hour curfew because there isn't much more that is being affected. And of course, we've had situations where there are some people who said, well, we live by this cruise ship coming into us, so we have to keep our port open, even if the risk is great. So there are different things. So don't expect that Trinidad and Tobago will do exactly what others do. But there are some things that others are doing which we may find useful, and what we are doing that others have found useful. And so we set off on the road not of using the law as a hammer to force people to follow the law and to obey the law. Because if we had any guarantee that obeying the law was the end of the process, we would have gone that way from the beginning and just say the law is stay home and nobody comes out, nobody does anything wrong. But we know it doesn't go like that. We started from the beginning knowing that it is personal and personal responsibility. It is better if we take the population along with us step by step and make the adjustments as we go and as the circumstances demand. And as we get the advice from our healthcare professionals, many of whom spent years studying these things, to be able today to give us advice at short notice. Because, you know, I can tell you as Prime Minister, there's no shortage of advice coming to me from all quarters, especially from persons who have not thought it through. But we rely on the healthcare professionals who will tell us how is the best way to respond to the data and the behavior of this microbe. So we are now having to accept the good response of those who are responding properly, and I want to thank all members of the national community who are responding properly. And we have now to focus on two things. One, the rate and level of our infection as a population, and two, dealing with those people who are still thinking that this thing is a joke. And as we go forward, we will make adjustments to respond to those two situations that are with us and will remain before us. And one thing that has not changed is that we do not know how long this will be with us. But we have good reason to believe from the data and from how it has gone from those who are ahead of us in the responding to this virus, that certain things are likely to happen ahead of us. So in the coming weeks, I would say the coming 2 to 3 weeks, we will see how successful we are, have been, and what is in front of us. So let us not get impatient, because impatience is the surest way of making the mistake of thinking that we have gone past it when we haven't. And we said early on that there are consequences to the actions of trying to treat with it, and those consequences will continue to try to minimize the harsh effects, minimize the pain, especially for those persons who do not have the resources to make themselves comfortable, and those things are on the way. Today, I have been in touch with the Attorney General, who has been in touch with the judiciary, and work is progressing at this pace, at this time, with a view to determine what we can do to intervene in the prisons, to have persons who are there on the basis of not having been able to make bail, persons who are not violent and a danger from that standpoint, to see whether we could not improve the conditions in the prison by reducing the population and preventing the possibility of overcrowding, because that's a very, very vulnerable area. We've turned our attention to that now, and hopefully by the end of the day, I am anticipating that the Attorney Generals and the judiciary could tell the population what we can do with respect to prisoners in the remand yard, and for prisoners who have been convicted and on appeal, the population would understand that if there are things we can do there, I am hoping that with the broadest sense of, I don't say generosity, but sense of understanding, get those people out of there, and I trust that we can minimize our exposure there for certain categories of the incarcerated. So that would be another step that we take. And of course, I trust that by now, the population will understand that exercising outdoors and in public is not an essential activity. And finally, I want to say that if it turns out that the biology is against us, we will take further measures. And if it turns out that we cannot encourage and control the recalcitrant minority, that famous phrase, then the force of law is with us. I want to appeal to the population to take the advice that we are all given, whether you're in Tobago, whether you're in Central, whether you're in North, whether there's somebody watching to see if you're behaving well. Take it as a responsibility not to be recalcitrant, not to be uncooperative, not to be unreasonable, not to be irresponsible, especially to those persons, our senior citizens, who have a greater vulnerability. This is a good time for all of us to be subscribing to the codes of the Boy Scouts and the Girl Guides, because we must be our brother's keeper. If we do that, our officers and our experts tell us that we could come out of this with minimal damage. The Ministry of Health will tell us about where we are this morning with respect to the last 24 hours.
Thank you. Thank you very much, Prime Minister, for your leadership in this issue. Chief Medical Officer, Minister Cox, ladies and gentlemen of the media, wider listening and viewing public. My task this morning is to give you an update on where we are with COVID-19 and hopefully related to the international context. Internationally, to date, there are 876,343 cases globally in 199 countries and territories. Of that, unfortunately, there have been 43,519 deaths. However, 184,958 have in fact recovered. Where do we lie in these statistics? Of the global statistics, we have 89 positive cases, of which 49 has come from one source. We have had 5 deaths to date, unfortunately, and our deepest condolences go out to those families. And we have had 1 discharge. The 5 deaths to date fit the profile, the global profile of the disease affecting the elderly with pre-existing conditions, especially hypertension, diabetes, and so on. All the 5 deaths, without going into specifics, have been in that category, in that demographic, the elderly with pre-existing conditions. So where do we lie with this? The Trinidad average is 64 cases per million people. The global average went up since last I reported to you. The global average was 102 cases per million. Our average has remained the same basically because the increase in cases is statistically small. But the global average has gone up from 102 cases per million population to 112 cases per million population. What that tells you is that the virus is still very active around the world. And that is why the Prime Minister keeps imploring people, if we are to fight and beat this virus, the best thing for us to do at this stage, this week and next week, is to simply stay home. That will decrease the number of new infections, especially those 19,000 odd persons who would have come in before last week Sunday when the borders are closed. The fate of this country lies largely in your hands. If those people stay home and the rest of the non-essential people stay home, as we put you in a state of dormancy and keep essential services up, we will beat this and can beat this. So that is the update from the Ministry of Health. I will now hand you over to the Chief Medical Officer.
Okay, good morning, Honorable Prime Minister, Honorable Ministers, members of the media, members of the listening public. So my update this morning was specifically with regards to the clinical update of the patients that we have in Couva, in Cora, as well as under Eastern RHA. So in total, as Minister would have indicated, the number of confirmed cases to date is 89, number of discharges 1, number of deaths 5, number of patients in isolation at this time is 3. The total number of patients in Cora are 5. All of them are stable, not in any need of any supportive interventions. In Scarborough, there's 1 person who is in ICU isolation. Has been intubated. That person is on a ventilator as well in Tobago. In Couva, there's a total of 75 patients left. There's 2 persons in ICU, 1 person intubated, 1 stable. Of the 2 in ICU, there's 1 needing ventilatory support. So our 2 persons, there are only 2 persons, 1 in Tobago, 1 in Trinidad, that actually is needing a ventilator at this point. There are 14 persons in what we call a high dependency unit. It's a unit that is between an ICU, which is a very critical area, and a normal ward. So there's a step-up area. So there are 14 persons in Couva in that category. 13 of them are very stable. 1 of them we are keeping a close eye on to ensure if they need to go to ICU, they go to ICU, if and when that time comes. There are 59 persons with mild or no symptoms as well. And with that particular group, we have been looking at them to see if they get to the stage of 7 days post-symptoms. As soon as they do that, I have spoken to the thoracic medical director to ensure that they are swabbed to see if they're negative, and once they are negative, they do a second swab within 24 hours, and they discharge thereafter. We are also looking for alternative locations between Cora and other facilities, so we can decant the persons who have no symptoms and are doing very well out of Couva as soon as we possibly can. So as soon as we can get a place that is better suited for that category of patient, we're going to decant. So we will only have medium and high-level patients at Couva. So that will be done shortly. In terms of Balandra, we had started with 68 persons on that facility. We remain with 22 persons. There are only 2 persons with symptoms who have been tested and isolated thus far. The lab, and that's our old test, we are waiting on a result for those 2 persons. Everyone else is fine. The CEO of Eastern RHA, together with our mental health director, is having a discussion with them this morning by video conferencing to ensure that all amenities are being met and they are in good spirits. As well as the University of the West Indies has started to have liaisons with the staff and patients at Couva with regards to mental health issues. and assured me that he will also make a hotline available to them in the event that there are after-hours issues. They can call the University of the West Indies to get support, psychological support. So aside from that update, I think it's worth, now that everyone is at home and someone brought to my attention, we'll be sending out home care guidelines for persons, how to stay safe even within your home. If somebody gets ill at home, that they should be wearing a mask, how to isolate themselves, even in close quarters, not utilizing utensils from other persons, not sharing common spaces, those kinds of things. That will be coming out very shortly in terms of a guideline as well. So thank you.
Thank you, Dr. Parson. In keeping with our reporting, I want to just remind the population that in reporting our circumstance in the context of what the Minister of Health said, Trinidad and Tobago is one unit. We do not have a separate reporting line for Tobago as a separate territory. So when we speak about Trinidad and Tobago. But given the geographical constraints and our responsibilities, I've ensured that the overview and the monitoring and the sharing and the resourcing is taking care of Trinidad and Tobago. Yesterday I asked the Minister of Health to ensure that the senior people in Trinidad keep an eye on the senior people in Tobago, and maybe the Minister of Health can give us a little update on that.
Sure. Thank you again, Prime Minister. So we have well, before I go into what we are doing now, it was always done through the Office of the Chief Medical Officer to share collaboratively everything we are doing in Trinidad with Tobago. It's one healthcare system. The Chief Medical Officer would have communicated with the Secretary of Health on certain protocols to set in place. What we are doing now, we are doing more on-the-ground assistance, and there's a video conferencing going on right now with 3 senior persons who have been assisting the Ministry of Health, one seen about HR issues, one seen about facilities, and one seen about the protocols for clinical management, especially patient throughput through Scarborough General Hospital, to make sure that if you have a suspected case of COVID, they don't intermingle with the rest of the staff. That conversation is going on right now, and based on those recommendations, I will then have a chat with the Secretary of Health, my counterpart, to further assist in making sure Trinidad and Tobago follows the same guidelines across the board.
Okay, thank you very much, Minister Dayal Singh. Now, if you have a few questions, we take that. Yes, please.
Good morning, Mr. Prime Minister, members. Jesse Ramley from CNC3 News. Dr. Rowley, I preface this question with the fact that I understand the situation is fluid and is unprecedented, right? Given what you said, that there continues to be that minority that continues to not comply, and coupled with the increase in deaths related to the virus, what will be government's position or breaking point per se when it will probably seek to enforce stricter measures, perhaps even an SOE? I know you mentioned that before.
We are prepared to do whatever has to be done to ensure that we give ourselves the best. I know that there's a predisposition and anxiety and about state of emergency. I'm not entering that conversation at all. It is one of the tools available to our government if the circumstances warrant it, and if the outcome is an improvement of the circumstances of the people of Trinidad and Tobago. I said before, we're not dealing with fashion and anxiety. We have been taking steps of interventions, steps of exhortation, based on what advice we got, the nature of the problem, and based on the advice we determine what is the most appropriate state response. And that's where we're at. What I just said is that if the situation is deemed to be that we need to be more interventionist, and that intervention would put us in a better situation, then the government will have no difficulty in doing it. But last time I was here, I spoke at length about this whole question about the demand for a lockdown. And I thought I went into detail as to what that really means if we actually do that. For example, in our neighboring territory of Grenada, there's a 24-hour, 7-day curfew. Any government could do that if you wish, but it might suit that situation. Question is that what is best for us under our circumstances? When we get to that bridge, you'll be the first to know. Yes, ma'am.
What collaboration or consultation is done with the Commissioner of Police? He has just issued a statement saying that he will close down banks and supermarkets and markets and so on because of people congregating. And under the regulations, this of course is supposed to be banks and their essential activities.
Let's put it this way, right? The government operates in a variety of sections, and the commissioner's section is led by the Minister of National Security, who has been a frequent participant in these bits of public information. And under these circumstances, a little difficulty that we have been having is the synchronizing of the text. And I trust that this difficulty can be smoothed out. Banks are not to be closed by the Commissioner of Police. We went into detail as to how the banking sector is to function, is functioning, and the importance of the banking sector as an essential service. And therefore, I don't know that that arrangement of having them close at the behest of the Commissioner of Police is what we can expect. So we'll get our text sorted out as we proceed.
In the same, one of the things, well, two things. The commissioner in the same breath has said that on the exercising issue, exercising was not considered to be essential, but he did say that people could exercise in twos and so there seems to be a constant variance.
I think what the commissioner, you see, you have to look at where we're coming from. The government's overall position is what I said earlier, that we try to persuade, to encourage, to coerce, and to enforce. When the commissioner spoke about exercising, he was dealing with it simply in the context of enforce. The law to enforce and to arrest if you did not comply with respect to a person going to exercise, that wasn't in place because we didn't put a law in place to just if you come outside. How many of you seen the videos of some other countries that have this same problem? And they send the police out with battles and bamboo rods to beat people. We're not doing that here. We're not doing that here. We're talking to our population. And the commissioner, like every other officer, is talking to the population. But if you ask him about arresting people, then he will tell you, well, if you want to exercise the law, I can't present you with the law. But then you have another voice coming to you from the Minister of Health, from the CMO, from the Prime Minister saying, don't do it. Because if you do it, you are exposing yourself and the rest of the country. Do you need to be beaten with a bamboo rod to understand that? That is our situation. That's our situation. So we've said, we've been talking to you, giving you every good reason why you should separate from persons. The CMO went as far as to say, let us as a people behave as though everybody has this COVID, and therefore you treat them with dignity and humanity, but you stay away so as not to be in the range of infection. That's what the CMO said to all of us. That is not law. That is just common sense. So when the commissioner says about exercising, basically what we should see there is not that the commissioner said you could exercise, is that why would you, Mr. or Miss X, want to come out to exercise and expose yourself to the virus and expose all of us? That's where the conversation should be. And of course, it is not logistically feasible to go all around this country from Shejas to Charlottesville, from Carnage to Sandy Grande, and ensure that everybody doesn't come outside to exercise. We don't have enough police to do that. A lot of that policing has to be done by you, the individual. Yes, you come out and exercise, great, because the law says you could do it. So come and fill up the Queen's Park Savannah. Fill up Aranguez Savannah. Fill up all the savannas around, because we're exercising, because we're free. The law says we can't do it. We could do it. And then we get infected. And then we end up like those who are now burying their dead by the dozens by the hour. And then you blame who? You can't blame the CMO. You can't blame the minister. I shouldn't say you can't. You shouldn't, because I know you will. What we're trying to do here is to get public buy-in into a common sense action which lies largely with you. I heard this morning, I think it was the CMO or somebody from the health, saying that we're going to be talking to people as to how to behave inside your home, because you have that same problem inside the home. If somebody is sick, you got to stay away. And then the rest of the household has to be aware of that and respond sensibly. If you think you're exposed, or even if you don't think so, but you can avoid going to interact with your elderly parents or cousins or neighbors, don't do it, because you are exposing them to this invisible action. Maybe if the virus is on your hand, painted blue, you will know not to do it. On your face, painted red. But you don't have that. So the only thing you have is, let me stay a distance away from auntie and uncle and granny and the baby, because this virus may be. And the CMO says, assume that you're carrying it and react to that. Is that too much to ask? And waiting for somebody to come in a police uniform to beat you with a bamboo to do something that is sensible? No, we're not taking that line. We're taking the line that the population should be able to be so responsible in this time of crisis and emergency to know what your role is. Yeah.
A number of concerns raised by members of the police service regarding PPE. Are there any plans to provide them with such? We get the calls every day.
Well, not only the police service, all around, in the health department, whoever, personal protection equipment. If persons are operating in an environment where personal protection equipment is required, then they should and must have it, and we've taken steps to ensure that that is so. There are persons who will be out in an area where that is not a requirement, personal protection equipment, because what you are doing does not require it. But there are certain people who must have it because of their exposure. So we don't have a suit for everybody in Trinidad and Tobago, because we don't need to have one for everybody. But certainly our first frontline people, our first responders, and those who are on the job interacting with people who are either confirmed or suspected, or the environment might be such that it may be carrying the virus, or you're going into areas where you might touch it, that is all. So wherever it is required, whether it is the police, the hospital, the whatever, wherever you are, if it is deemed by the experts and the managers that it is required, it ought to be available. And as far as I'm aware, unlike what I'm seeing on television in many areas in Trinidad and Tobago, our people for whom it is a requirement, it is available.
The CMO.
Yes.
No, in particular reference to your question, the TTPS as well as the Defense Force are members of my interministerial committee, and if they need any PPE, that is either being furnished through Ministry of Health or through the ODPM. So up to yesterday, we would have met, and we made arrangements so that they always have the necessary PPE as well.
On that, there has been some discussion internationally about masks. Do we have any sort of recommendation for regular people wearing masks?
Discussion will keep changing. I think even in the U.S., they had an emergency session of their task force to discuss the use of masks in the general population. And every decision that we take as it relates to public health we need to bear in mind the particular intricacies and differences between countries. For masks, we have said all along, if you're sick, you should be wearing masks, whether you're home or not. You should be wearing masks to protect everyone else. And what we're hearing on the global front, of course, because you have a disease that is carried for a few days and can be transmitted just before you start to show symptoms, we don't know who has it. So persons of certain high-risk groups, the elderly, more so prone persons who are immunocompromised, if you wish to wear a mask, there's no reason why you shouldn't wear a mask. Aside from, and I think Minister alluded to it before, you should wear it properly, and you should be appropriately trained to do so, because there's a inherent risk with wearing a mask. If the outside of the mask gets soiled, and you dispose of it poorly, you can contaminate other persons, you can contaminate yourself even while you're taking it off. So, but again, I still think when you look at China, you look at larger countries, look at New York, they have large subways, they have large train stations. So if you're going into a very populated area in those countries, there is a benefit to wearing masks.
Yeah. Two questions, very quickly. One may require a follow-up, right? The recent increases over the past week, they as a result of the roughly 20,000 who would have come in recently through ports just before the borders were closed?
I don't think there's a general. When you look at our numbers outside of the 49 persons that have converted from the initial group, the cruise ship group, our number is roughly 40. And we have basically gone at about 1.8 persons per day in terms of conversion since our first case. The numbers have remained the same. It is the same sort of trajectory we are going on since the 12th of March. So there hasn't been an increase. We expected to see an increase over the last few days, and we're still looking out for it. As I said before, up to the end of Sunday will be 14 days from the time those persons came into the country. So this period is very critical, and we're looking at the numbers. We're increasing our sampling for at-risk groups, people that would have traveled, contacts of those that would have traveled, to see if we can pick up clusters. But the numbers have remained fairly stagnant, and we're happy for that at this point.
This position, is the spread, the expected rate, if we are trying to flatten the curve, is this current rate?
Well, our rate is very low. So the curve, we haven't seen a spike as yet, and that's where we want to keep it. So again, it really depends on personal responsibility at this point, how well we can adhere to the cries of all of us to stay at home, stay safe, and not spread it beyond your homes. The more we go out and commingle, the greater the risk of having a spike, and that's what we're trying to avoid.
We have not yet noted a community spread just yet.
Yeah, when I had the meeting on Monday, I believe, we had indicated that 2 cases are potentially local cases, meaning there's no definite link to travel, there's no definite link to a suspected or confirmed case. Local spread, community spread can be widespread, so meaning that you have a number of people in a cluster. So it goes from one person being local spread, then you develop little clusters around that person for secondary and tertiary cases, and it goes widespread like we're seeing in other countries, which is mass community spread. So the appropriate epidemiological term is local spread, but it's confined to a couple people now. The majority of cases that we're getting are still imported from that, I believe, from that cohort of 20,000.
So can you just explain, has the criteria for testing in any way been changed? I know we had the travel, recent travel or anything like that. Has that been changed in any way given these suspicions of local transmission, or the evidence rather of local transmission?
Right, so it depends on the linkages that we find with existing clusters of cases. So we do primary contact, secondary contact, tertiary contact, and we follow them up for 14 days. If any of those persons meet the criteria, meaning develop symptoms, we are testing them right away. So in that regard, I don't think it has changed, but we continue to use the same criteria, but as the number of cases increase, we will have more secondary contacts, we'll have more tertiary contacts, so we are testing more people.
But do you think that because the criteria does specifically say travel, recent travel, that we are missing cases?
That has never been our criteria. Our criteria is persons that would have traveled, persons that would have had contact with somebody that would have traveled, persons that would have had contact with somebody that is suspected to have the disease as deemed by a healthcare professional, persons that would have had contact with a confirmed case, or any secondary or tertiary person that is implicated in a gathering.
Okay, and just one quick follow-up. Can you just give me an idea of how long contact tracing takes? Like, how long does contact tracing
Once
take?
from your date of exposure, it's supposed to go for 14 days past that point. So if you are exposed today to someone that is in any of those categories, we will follow you up until day 15. If day 15 arrives and you have no symptoms, no signs and symptoms, the contact tracing ends on you as a person at that time.
Let me just refer you to one thing. I had suggested to CARFA that they do something to alert the population about testing. CARFA today hosted, I think, a 1-hour press conference, video conference, and they explored the whole issue of testing through and through. So if you need any further information, I think getting a clip of that will be very, very useful, because I did insist that they speak to the population solely about testing.
In terms of expanding testing, that might have been mentioned before. Are those plans still on stream?
Yeah, so we're doing a couple things. CARFA has agreed to take additional samples from Trinidad 1. We are trying to build capacity in Trinidad very soon to actually test on our own, which of course will have to be validated by CARFA before we do our first test. So we're trying to do that at North Central, Southwest Region, Regional Health Authority, as well as our Trinidad Public Health Lab. So we're in the process of working out the intricacies of the lab, making sure we have the necessary reagents, training of staff, and staff in place. Once we do that, CARFA has to validate our testing capacity, and then we can go full ahead with testing.
Did the machines for testing arrive yet? I think they were supposed to arrive on like Friday.
Yes, the machines for testing are in fact here. So we have an existing machine at CARFA, an existing machine at North Central, an existing machine at MRFTT. The new machine, initially we thought we'll put it at TPHL, which is in the same CARFA compound in Port of Spain. But we had a meeting on Saturday, and we decided to place that machine in southwest, so they could do a lot more testing there. So once we ramp up our testing capabilities, it will be CARFA, North Central in the first instance. We are moving to get that one up as soon as possible. MRFTT, they already have the machine. All they need are the test kits and the validation by CARFA. And then finally, hopefully, to bring Southwest on stream. I think about 200, 250.
I think anywhere between 100 and 200 depends on the site and depends on the staffing and all of that.
We have like 4 or 5, is you saying? How many machines we have?
Right now, we are only testing at CARFA, right? My hope is, and we are working very, very quickly to bring North Central up. That will be 2. 3, we already have an existing machine at MRFTT. So we just have to get the test kits there. That will be 3. And then the 4th machine, we took a decision to place it not in TPHL, Trinidad Public Health Lab in Port of Spain, but to place it at San Fernando General Hospital to ramp up our testing capability in San Fernando.
All right, I understand. So I'm just trying to get an idea. So potentially we could have like 1,000 tests.
Potentially, yeah, potentially.
Parashram, you had said in an interview on the Sunday Express that we should all behave as though we have the virus.
Sure.
And I'm taking that statement in the context of the position on masks. We've seen all over the world, in fact, companies are being engaged in making not necessarily the sort of sophisticated surgical masks, but cloth masks that people can use and wash and so on. So why is it then that we are not sort of looking at those countries? Because we've seen that the countries where the curve has been flattened, like Singapore and South Korea, the mask policy was in full.
I mean, we look at other countries around the world for examples of what would have worked, and there's a lot of confounding factors. So I don't think it's the mask alone that would have worked. A lot of them would have had school closures, they would have had stay at home, they would have had closure of their borders, which we have in Trinidad as well. And you have to look at it in the context of the way populations move and the density of populations as well. So all of those things have to be borne in mind. There's an inherent risk with telling persons, everyone in the society to wear a mask because of basically not knowing how to use it, how you're putting yourself at greater risk in some instances. But again, for those high-risk populations, there is some benefit, and they've been proven to have benefit. And especially if you're going to a crowded area. Some countries have advocated for it. But of course, we are sort of, in terms of the research as it relates to it, no one has come out definitively to say that it is better to wear one than not to wear one. But we are looking at it. This is a new virus. It's changing every day. And I had a discussion with one of my colleagues this morning, and when HIV had just started in the 80s or thereabouts, the same conversations were happening. How is it spread? We did not know a lot about it, and people were taking all sorts of protective measures that years later we found out were not necessary. So we have to base our decisions based on the research and based on the best advice for our situation in Trinidad. Again, a populated country with people having to use subways and having to use trains means that you have a lot of people in a small area. We are trying to dissuade that as much as possible in Trinidad and Tobago at this time. If we can do that successfully, I don't think there's a need for people to go out there and wear masks.
I want to ask the Balandra, we have a story, the front page of the Sunday Express, about the people at Hoover saying that no sanitizing agents and so on. And I'm looking at the fact that out of the 68 people from Balandra, 49, you said, people developed the virus, which is like 72%, which if you look at other cruises, for example, I'm reading about other cruises, you don't have that kind of percentage of infection. So is it that can you give assurances that the quality controls will and are adequate both in Balandra and in Hoover, because we have this recurrent
So
thing.
I'll give you the example. When the persons came in from Balandra, I think within about 2 days, if not 3 days, 40 of them tested positive. You would recall there were 2 persons that came on their own from that cruise ship, and they stayed somewhere else. They didn't stay in Balandra. They stayed at Cora Hospital. One of them became positive, the other one was negative. Of the 3 persons that came on a flight separately, after the 68 people, I think 2 or 3 of them actually became positive as well. The time frame that they spent on the ship, and we have seen articles worldwide saying that coronavirus can survive up to 17 days on certain areas of a cruise ship. A cruise ship is a place where we have high levels of infectious disease. If we have gastro a high proportion of people on a ship will get gastro because they're in close contact. They have little sunlight below the deck. Is really a breeding ground for infectious disease. We treated it from the start as a very high-risk group because they would have spent 8 days out on the cruise ship, not being allowed to dock. They stayed in close quarters. There's the high reality. There were positives on board, and that's why we sent them to Balandra in the first place. Could you imagine if we sent all 73 persons from that point to individual homes around Trinidad and Tobago? What would have happened to Trinidad and Tobago? Based on the 73, if you have family contact as primary alone, we're looking at close to 300 primary contacts. And then the spread would have been very much like China and every other part of the world after that. So I think the decision to have them in one place was based on their prior exposure, not based on the exposure in Balandra. I am assured by the CEO, even up to now, that the isolation and sanitization is being done to a very high standard in both places. And especially with the existing cohort that are negative now. So they are separated out. If we get anybody with symptoms, they are put in isolation right away. We're testing them, and once we get a positive result, they're moving them out. So I think the infection prevention control guidelines are in place in both Couva and Balandra, as well as Cora, to ensure there's no cross-contamination and cross-infection.
I just want to deal with something in Couva. We are getting complaints from the patients that the air conditioning is too cold. Let me explain to you why the temperature in Couva has to be at a certain limit. Remember, the healthcare workers in Couva have on PPE. When they don their PPE, they are in a heat environment now. And for them to properly do their work, they have to be kept cool. If we drop the temperature in Couva, or if we raise the temperature in Couva to accommodate the patients, then the healthcare workers who are there to protect the patients and serve the patients, they become terribly uncomfortable. And it means they will have to shorten the period of their shift and use up more PPE. So the point has to go out. This is a very difficult situation. All of us are going to have to do a little bit of giving, and all of us are going to have to do a little bit of taking. It is not ideal. It is not ideal for the patients. It is not ideal for healthcare workers. But we have to come to a happy medium where we look after the interest of both the patient and the healthcare worker, and it's going to take a bit of give and take, especially with the temperature.
Can you give us an idea of the working conditions for these healthcare workers? I mean, the time of their shift, is there burnout? Can they go back home to their families? You have to be in isolation. What's the conditions like for them at Couva and, well, in fact, everywhere, I suppose?
So we were in talks with North Central just to assure everyone that they are adhering. There's a healthcare workers policy, draft policy right now, that they have all been adhering to. The CEO, again, is the charge. The CEO of North Central is the lead for that organization. We have asked, I think Minister had asked the chairman to have some executive role, and we are trying to get a chief of staff appointed to that hospital, if not today, by tomorrow, to ensure that all conditions are as it should be for patients and the physicians. When we started off with a very small number, what was happening is that there was dual control of the division from Cora as well as Eric Williams. Now that the numbers are going up, I think we need a dedicated chief of staff and team, including a hospital administrator and a nursing administrator, to assure that the population there is safe.
Earlier, based on the report from this morning, some of the complaints of the patients are food. I guess they don't like the conditions in terms of the restrictions to their mobility. Some of them say they're healthy and they don't understand why they're still in.
I mean, the healthy ones, and that's why I think we are trying to get the persons that are well, the symptom-free patients that are recovering out of Couva. It is a hospital environment, and had it not been that they were contagious, in a normal hospital setting, they would have been discharged. They have to recognize they have a contagious disease. We have to make sure that they can't spread it to the rest of the population before we discharge them. There are protocols to do so, which we have to follow. Otherwise, we run the risk of letting them out prematurely, and they infect their families and everyone else.
I mean, family can't bring food for them, for example. I don't.
It's a restricted zone because it is an infectious disease hospital at this point. So there's greater restrictions than a normal hospital, if you would imagine.
They can take complaints too.
The chief executive officer is the person in charge of the operations for that facility.
What is the protocol for critically ill patients? We read about people overseas having the opportunity to speak to their families via video chat or phone call. Is there a compassionate policy that,
as I said before, there's no restriction in phone use for those patients that can use their phone. And we have gone a step further to try to get the psychiatric and psychologists, that group from UE, to actually do video conferencing with them, as well as setting up a hotline so that they can discuss things with them, have their fears alleviated even after hours. They can talk, and they can talk to their families. Yeah.
Given the current condition here at home and regionally, internationally, what's the status of the country's medication cover, per se?
Okay. That's a very good question. So we have been looking at our medication cover since January, when we first started to plan for COVID. You would have noticed, as of now, you have heard about no medication shortage in Trinidad and Tobago, except for maybe one or two items for which there's a global shortage over which we have no control. But as I said, these gains that we have made, where the hospital system is running, it hasn't occurred to anyone that the regular hospital system is running. Patients are still going to all their health centers. All major hospitals are running. Compare that with what is happening across the world, where a pregnant woman cannot get a bed in a hospital now to have a baby. I think sometimes we lose sight of how well we are in fact doing. So we have discussions, we have a spreadsheet back at the office with all our suppliers, all the drugs that they are bringing in, all incoming shipments, identifying all critical drugs based on what is called the VEN list: V, vital; E, essential; N, necessary. You pay attention to your vital and essential. Those are drugs that you need for life. Necessary in normal times will be something like Panadol. But in these times, the drug of choice to treat a COVID patient is Panadol. So that becomes crucial at this point in time. So we are paying attention to all our vital drugs, essential drugs. So far, we have had no mass disruptions in either the delivery of services at the hospitals or drugs. We are working with all our suppliers on literally a daily basis under the office of the principal pharmacist to keep the drug supply going. However, let me explain briefly. We don't make vast amount of drugs in the Caribbean. 80% of what is called APIs, active pharmaceutical ingredients, so like for Panadol, the API is paracetamol. 80% of APIs, active pharmaceutical ingredients, are manufactured in one place in the world, China. And they supply all drug manufacturers around the world. So all drug manufacturers are going to be adversely affected. India supplies about 40%, I believe, don't quote me on that too much, of all generics around the world. And they get all their APIs from China. Luckily, China has started to open back their plants that make APIs to then ship out to the manufacturing sites around the world, including India. India had imposed a ban on exporting drugs about maybe a month ago, and I think now they are starting to lift it. But what we have done at the ministry, I have written to the embassies of the following: China, India, one other, the United States, to try as far as humanly possible to seek their assistance in keeping the drug supply open to Trinidad and Tobago. What we have also done at the ministry level to make sure we don't waste our pharmaceuticals in this time, we took a decision about 2 weeks ago that CDAP prescription refills will only be done now on a monthly basis. You'll only get 1 month supply, as opposed to the old system, you could get 3 months supply, to make sure we don't have wastage and hoarding. We want to keep the drug supply going, hospital systems are going, so we're in a pretty good place. But if the population doesn't stay home, and if we get community spread, that hard-fought victory could be wiped out in an instant.
Well, Prime Minister, in fact, all three of you, sir, how are you guys doing? How are you all doing? I mean, condolences to you on the death of your brother. I know you and your daughter being in New York. How have you been coping with managing this situation? Dr. Parisram, Mr. Dial Singh, you all are the three leads. How have you and the cabinet been doing?
Well, at the level of the cabinet, we try to ensure that the cabinet functions seamlessly, and we are continuously in conversations, either in part or in whole. I meet or I'm in contact with 1 or 2 ministers at any point in time. Sometimes I would meet with 2 or 3, like this morning I met with 3. And so we've been keeping the cabinet together, but this week there'll be no cabinet meeting tomorrow. As a matter of fact, today I go to Tobago this evening, my brother's funeral tomorrow. I go there and I may stay in Tobago for a couple of days with my family. And I draw my strength from the people of Trinidad and Tobago. I see so many good aspects of how we are coping that I just have to cope. For example, I want to publicly acknowledge the human service being provided by Dr. Parashan and his team, who appeared on the scene, because before that, I'm sure not very many of you knew any of these people, because public health is not the star boy in health. But when the demand was made, all these people appeared at the front, and they were able to take charge. And the strength of Trinidad and Tobago, I started off this conversation with the public saying, we have strengths and we have weaknesses. And one of the strengths that I knew I could count on was the strength of the Ministry of Health. Because while the Ministry of Health might do 1,000 procedures and one go wrong, that is the one that labels the ministry as the worst. It's Trinidad. Trinidad is not a real place, right? Nobody pays attention to the 999. But I know that some of the best quality personnel on the public payroll in this country would be they are in the Ministry of Health. And when called upon, as they've been called upon every day, those 999 procedures, they deliver them well. And if something goes wrong and you want to misbehave as you normally do, well, okay. But in this arrangement, that investment, our human capital there, and our infrastructure have come to the fore as one of the strengths of Trinidad and Tobago, and we're hoping that we don't lose that strength by acting improperly.
Thank you.
Yes, Rio.
Doc-
Let's hear you.
Some persons have taken issue with the timing of your meeting with the Vice President of Venezuela. Firstly, because it came at a time when the borders were closed.
What is the right time?
Well, but the other issue with the timing is that it coincided with the indictment of Maduro and his senior officials by the U.S. government.
Let me just put that to bed. The meeting that I had with the Vice President of Venezuela had absolutely nothing to do with the Maduro United States criminal development. Absolutely not. As a matter of fact, it didn't come up. And let me just say one more thing, because I see there are those who believe that there's something here to make Janjat over. When, as Prime Minister, I meet with the Queen of England, the Secretary General of the United Nations, the President of Ghana, or the Vice President of Venezuela, I want the people of Trinidad and Tobago to understand that it is all in the interest of the people of Trinidad and Tobago. And that is as much as I would say on this and similar matters. For those who believe that I should come out in Woodford Square and give a detailed ball by ball as to every breath we took in matters of national security, in matters of national interest, in the broader sense, I think you're just hoping for too much.
When would the government follow the international pattern of informing the population of areas where there is local or community spread?
So, we have taken that decision today. We will make a presentation on that tomorrow, because we now have our GIS system up and running. It has been up and running, and we will bring that to the press conference tomorrow, which will be held at 10 a.m. at TTT, so you could see the GIS mapping for Trinidad and Tobago.
Final question. Missions abroad, have we been in contact with how are people abroad doing, or particularly on missions abroad, New York, I guess Europe, wherever?
Yes, we have been in touch with our missions around. Our missions are basically battened down. For example, Ambassador Penny Beckles, where she lived in New York, from the very first restriction that was placed in New York, she was caught in that. So we are battened down around the world because it is the sensible thing to do. Or people in Venezuela, or people in, we have people in Europe, and there have been a number of hotspots in Europe. And you did mention my daughter in New York. My younger daughter is at Columbia University, which just happened to be ground zero in New York. So she's on staff there. And again, she's working from home, battened down, staying indoors, following the instructions of the authorities there. And basically, there isn't much more we can do. I must admit that while I'm managing the affairs of Trinidad and Tobago, every hour I think of my daughter and I think of New York. And I pay a lot of attention because there's a lot to be learned by following what's happening elsewhere. And hopefully we will be able to improve our management of this situation. All we're asking is that we don't disregard the importance of cooperating with those who know better and are expecting better of us.
In terms of the hotline, I know it's been expanded so far, but we still get complaints that it's being inundated.
Yes, it
Are
is.
there any plans to further expand it?
Yes, we are looking at it. I had mentioned a couple of weeks ago, one of the ways to manage that hotline, because we just can't keep on expanding in terms of numbers of people. We want to use technology, and we are supposed to have an app coming out very soon, which will do a lot of screening, so people don't have to physically speak to someone. I understand that the hotline is being overwhelmed. I asked the population to have some patience, but also to use the hotline properly. We are still getting thousands of calls to the hotline that should not go there, asking about all sorts of things except about COVID. So the population can help, and I'm glad you had asked that question, and I hope the app that we want to bring on soon could be a screening mechanism to make the hotline freer. Sure.
Has any cabinet minister taken a COVID-19 test?
I know I haven't.
Yes, I have had my test done at the appropriate time, and I've not been deemed to be positive. That means it was said to be negative, but I think Dr. Parasram on many occasions explained what that meant. I've been screened, and I've also kept a very low contact level for 14, 28 days and so on, because I want to be here to serve you, so I'm not taking any chances. But tomorrow I have to go to Tobago, and I'll be moving from here to there very quickly. And I'm going to be in a funeral that only allows 5 people. You know, I'm really experiencing what many people are actually experiencing, so I have a first-hand experience. I'm trying to figure out how does one conduct a parting with 5 people in a very large family. You know, it's not a nice situation, but as I told you all before, I was kind of like aware of this since I was about 10 or 12 years old, when my grandfather told me the details of the 1918 flu. And it was difficult to grasp the mind around it, but we're living it now. Thankfully, we are not at the stage of shuffling coffins. You know, I felt a chill just looking at a convoy of army trucks going into an Italian town to take out coffins. And imagine, you know, dealing with, you know, we hear in the news, and the news is desensitizing us. 200 people died. The one little hospital in New York, 24 people died in one. You know, so even the news itself, because it's so common, so frequent, we are now dealing with this new normal. But those of us who are actually having our finger in the wound, I could tell you it is not a nice thing. But we resolve to fight it and to beat it. And that's what I'm asking the people of Trinidad and Tobago to do. Let us fight it. Let us fight it together. Let us be responsible at the individual level. And if we do that with the guidance of our healthcare givers and our professional staff, the experts who are more familiar with this, and those who are manipulating the data and extracting from it pearls of wisdom for us, let us just follow them. You know, don't be an expert because you think you have a big mouth or you have access to the media to generate a story, which upon examination may be found not to really have any merit. Personal responsibility, common sense are the two phrases I want to leave with the country this morning. Thank you very much, and we'll see you tomorrow.
And the